Let's talk about obstructive sleep apnea. Many patients come in to me because they've been told that they snore, they're having difficulty sleeping, or they're tired during the day. In order to understand what obstructive sleep apnea is, we need to start at the basics of what happens in the body during an obstruction. When we fall asleep at night, the muscles of our body relaxes, as does the jaw, the tongue, and the soft palate that goes up and down when we talk and sing. It can be very easy then when we are in sleep for that to become relaxed and block the air moving in and out. When air is moving in and out, such as now when we are awake, we are not making any noises when we breathe. However, if tissue gets in the way, that tissue will vibrate, and that's snoring. We know that snoring is a risk factor for obstructive sleep apnea. Not everybody that snores has obstructive sleep apnea, but it's certainly a risk. What happens if air cannot get through is that the oxygen levels in the body will start to drop. When those oxygen levels drop, our bodies are very smart, and it will send an emergency alert to the brain that says, oxygen's getting low, we need to do something about this. So a surge of adrenaline will go through the body, increasing the heart rate to circulate the oxygen that is available, as well as kick you out of deep stages of sleep in order to wake up enough to open your airway. What's beautiful about this is that it keeps you breathing at night. What's hard about it is that it doesn't allow your brain to get the adequate rest that it needs in deep stages of sleep. If you are not breathing well, you won't sleep well. The other thing that research has shown is that it's very hard on the heart. So when the heart has to work overtime at night to compensate for these dips in oxygen level, over time that increases risk for cardiovascular disease such as heart attack, strokes, and arrhythmias. That is why it is so important that if you have suspicion that you snore, you're tired during the day, maybe you have people that tell you stop breathing, that you get it investigated. That's the nice thing about having a sleep study here at Reedsburg Area Medical Center is that we can start with that investigation, start with asking you the right questions to see if you do have high risk for obstructive sleep apnea and how we would go about testing and treating it.